Doctors in Australia are doing a podcast to keep the public updated on coronavirus research and policy. And this week, they tackled an important question. Can the coronavirus be spread through farts? The answer is critical because it could lead to a breakthrough in blaming coronavirus on the dog. Turns out farts are dangerous for the same reason coughing and sneezing are, because flatulence itself is an aerosol-generating procedure. Hence the old rhyme, beans, beans, the magical fruit. The more you eat, the more you perform an aerosol-generating procedure. Here's what the good doctor had to say about corona farts.
I think that what we should do in terms of social distancing and being safe is that a policy on the part of the entire Australian population should be that you don't fart close to other people and that you don't fart with your bottom bare.
I'm hoping that's pretty much always the advice.
How did we get here? We're putting masks on children, forcing people to accept poorly tested medical treatments, and now considering implementing discriminatory health certificates. As little as a couple of years ago, such measures would have seemed more at home in an Issac Asimov short story. But it's worth it, right? We're trying to stop a virus from killing the elderly and vulnerable in society. We're making sacrifices to keep those people safe and healthy, and we should be proud of that. But what is this COVID-19 pandemic exactly? Where did this come from? And why do we fear it to the extent that we do? Look, I know it's not cool to question it. I don't want to be the bad guy, the COVIDiot, the granny killer. I love my parents, and I value the wisdom of the elderly. I believe in a society that protects people who cannot protect themselves. Any one of us would make massive sacrifices to achieve that. And yet, I have questions. I mean, don't you? We don't vocalize them because we don't want to be seen as that guy. But quietly, in the backs of our minds, don't we have a few niggling little questions that never seem to get answered? Like, well, here's one that keeps persisting in my mind, if you'll permit me the hypothetical. If the media hadn't reported on COVID-19, say they had decided it would cause unnecessary panic and minimized it instead of ramping up the news cycle to warn people, how would you have detected that COVID-19 exists? If you hadn't been presented with 24/7 case numbers, death counts, contact tracing data, and vaccine uptake stats, would you have noticed that we're in the middle of a pandemic at all? Sure, we might have had moments like, wow, I know 2 people who lost a parent in the last couple of months, or gee, Dennis got such a bad flu he had to go to the hospital, that's weird. But without a name to attribute that to, without a computer graphic of that blue ball of gunk with its scary red spikes, wouldn't you have been more likely to assume that it was just another, albeit particularly bad, flu season? It's not like we haven't had them before. 2019 was also a very bad year. It's just that no one sounded the alarm. Surely in the back of your mind, the question still begs, what if the powers that be had chosen a less sensational route? What if we had quietly protected our hospitals, nursing homes and retirement facilities, gently reminded the population that flu season can be deadly, and encouraged people to be sensible and responsible with theirs and other people's health? If the name COVID-19 had never been uttered, knowing what we know now about infection rates, morbidity, testing and treatment, would you have become this fearful? And this is not to suggest by any means that there is no pandemic or no cause for concern. I'm just asking you to acknowledge that some proportion of what you feel about it has been determined by the way it has been reported to you. You may think that's a low percentage, and that's fine. But it's not zero, is it? So, do you really still think that the COVID-19 narrative came entirely from a wet market in Wuhan? Or is it at least partially a creation of the media? A creation that, with subsequent amplification by global organizations, governments, and societal pressure, was injected like a poison directly into the fear centers of your brain. It's a question worth pondering. You don't even need to voice it. But if, for you, like me, it sticks in the back of your mind, occupying your thoughts as you drift off to sleep, perhaps you'll also dare to ask the slightly scarier question that logically follows. Why?